Welcome to the GSK Vaccination Patient Identification video. Here you will learn about the different ways you can be more proactive in identifying vaccine-eligible patients within your pharmacy. This video will help you identify pre-visit opportunities and explain how to utilize support personnel. These strategies are provided for you and your pharmacy staff to help keep your patients and community healthy.
Before a patient even enters the pharmacy, it's important to start thinking about which vaccinations you might recommend. Pre-visit workup information can ensure that you and your staff are working as efficiently and effectively as possible to identify vaccine-eligible patients. From patient vaccination history, to patient profile eligibility, to inferring needs, we'll discuss how and where to find important information that will help you identify immunization gaps with your patients.
It's important to know which vaccines your patients have already received. First, check the patient's history. You should also check the patient's history for potential contraindications to vaccination. The record might not be complete if your patient received vaccination from another pharmacy or from their primary care provider. So to help make the best recommendation possible, check the state immunization registry if you have access to it. When reviewing your patient's profile, think HALO: health, age, lifestyle, and the occupation of your patient to determine what vaccines you might recommend. For example, patients getting ready to attend college may be eligible for vaccination against meningococcal disease.
Consider a patient's situation in assessing vaccination eligibility. For example, is your patient's wife pregnant? Then he may be eligible for Tdap vaccination. Does your patient have a medical or chronic condition such as diabetes? For patients with diabetes, you would think about recommending a vaccination for hepatitis B, depending on the patient's age. As you are aware, with your guidance, techs and support staff can help with routine tasks around the pharmacy. Through collaboration and defining responsibilities, you may have additional time to concentrate on assessing your patient's vaccination needs. As you know, defining responsibilities for your support staff is important so your pharmacy can run as efficiently as possible. Defining responsibilities should be done in compliance with your pharmacy's policies, as well as applicable laws and regulations. Pharmacy staff can help with issuing patient questionnaires, pulling up patient profile information, and gathering vaccination supplies. This may allow you more time to interact with your patients.
Your time is valuable and there are many demands placed upon it. If possible, delegation of tasks to pharmacy staff may free up more time to identify vaccine-eligible patients. Delegating tasks should be done in compliance with your pharmacy's policies, as well as applicable laws and regulations. Pre-visit workups and appropriate use of support personnel are two ways to help you support your patients when it comes to vaccination. GSK is dedicated to providing you with the information and resources you need to help make a positive impact on the health of your patients and your community. Together, let's make a difference in your patients' lives, one vaccination at a time.